Good morning and welcome to the show, and thanks for waking up with us. This morning we're at Marine Max out on Panama City Beach, and we're here with John and Bob, and you've got something going on this weekend, don't you, John?
We have a big seminar that we're hosting, and Bob Fowler is our resident expert and host of our monthly seminars. I'm going to let Bob tell you a little bit more about it.
Well,
Thanks,
Bob,
John.
what's this seminar going to be about?
Well, I started the seminars over 12 years ago, and we have them every month. And this next Saturday it'll be on electronics. We always do that at the end of November. And we find a lot of people that have fishing boats, but not just fishing boats, all the boats. If they're going to do anything electronics, maybe a new boat, they're going to install new electronics, or it's time for an upgrade. There's new stuff that's come out, and so November has been a good time to do that at the end of November. And we see a lot of people upgrading their electronics or buying new electronics.
Do you see that people maybe buy things they don't fully understand?
Yeah, that happens, but we train them. And it's this next Saturday we're going to have Dr. Hughley, who is my resident professional. He is with the United States Coast Guard Power Squadron out of Fort Walton, and he's an electronics expert. He's going to have a multimedia presentation and talk about all the various aspects of marine electronics. It's going to be a general overview, but then there'll be some hands-on training and hands-on use and what this does, what that does, how you do this, how you do marks, how you go to your landing points and things of that nature. And then Lee Spiva, who is with Marine Electric, is a professional also and installator. And he'll be with us and have special discounts for anybody that would like to upgrade their electronics. He's going to field questions with Dr. Hughley. It's always a great time, and we have a lot of people who come and with great questions, and it's just
just for the layman who may not be a boat owner or they're thinking about getting a boat. What are the types of electronics you'll find on a boat nowadays?
Well, from small, used to you had to have different pieces of equipment for different uses, but now you can get a combo pack, even as small as a 6-inch, that will have a GPS, chart plotter, and a fish finder all in one.
Yeah, is that what I'm looking at here? Is that something?
Yeah,
like
this is actually a touch screen by Ray Marine, and called a hybrid touch. And on this particular boat, we have side-by-side screens because this is a boat that goes out 75, 100 miles, and most of our owners like redundancy. They like a side-by-side. They'll have the chart plotter and GPS, maybe fish finder in one, they have radar on the other, or they can change it up either way. So, it can get it as elaborate as you want or as simple as you want. Maybe someone has a boat, they're just going to go in the bay in the backwaters and they want the little 6-inch screen. Well, today the electronics are fantastic and they're easy to learn. When we install them, we train on them as well. So
so you just don't sell somebody an electronics package and say good luck with that.
No, that's right.
You've got to learn how to use it.
And of course, the best thing is, when you get, and we tell our people after the training, the best thing for them to do is get on their boat, get their owner's manual, go through. It does that. Oh, it does this, because they need to be familiar with it, and they're going to forget a lot of the training. But when they're on the boat, they don't want to be having their manual, well, what does this do and what does that do? They can just spend time on the boat, like anything else you're learning new. Spend time on the boat with your electronics. Even when you're not on the water, you can do that.
Yeah, if somebody is watching this and they say, I want to go take that electronics class with Bob, do they need to do anything? Do we need to register, or do we just show up? Or
they need to call in or register online. They can go to our website at www.marinemax.com. and the Panama City Beach store, look at the events, and there's a registration there for the electronic seminar. And it's free. We don't charge.
That was my next question.
Yeah, we never have charged anything for our seminars here. Last month we had last week before last, for a hands-on rigging class, we had over 60. In that class. Yeah. And we'll have a great turnout for the electronics class, but they do need to register, either call or register online by email.
I know, and you guys have a great classroom here. We've taken a walk around there before, and so you've got plenty of room.
Absolutely.
So all you really have to do is go to the website, register for it, and show up with your questions.
That's it. We'd love to see everybody come.
Bob Fowler, thanks so much for getting us smart on marine electronics.
Thank you.
And good luck with the class.
Thank you.
And we'll be right back after your local weather, brought to you by the West Pittman Law Firm, westpittmanlawfirm.com. Welcome back to the show. I'm here with Dr. Tara Griffin at Emerald Coast Dental Sleep Medicine right here on Panama City Beach. You know, Emerald Coast Dental Sleep Medicine. I know what Emerald Coast means, I mean, because we live here. But the dental sleep medicine, we usually don't think about dentistry and sleep at the same time. Or if you have a problem sleeping, it could be really related to a dental issue.
Yes, absolutely. Many people think that I put you to sleep in order to do your dentistry when they hear dental sleep medicine, but that is not what we do. Yeah, absolutely. We actually treat sleep breathing disorders such as snoring and sleep apnea with dental appliances.
Now I see you've got this thing here, and I'm looking at OSA, or obstructive sleep apnea. Now I know what sleep apnea is, and what does obstructive mean?
Obstructive is the type of sleep apnea where the airway collapses or the airway obstructs, and so it gets blocked during sleep. And so we're able to treat that with dental appliances because we help splint the airway open.
And how do you do that?
We have some different types of appliances. Basically, they help hold the jaw forward. This type of design does, so it doesn't fall back when you sleep at night. And we also have some corrective appliances that actually help grow and develop and change all the anatomy actually, and grow the airway.
You know, so many people who have sleep problems go to their doc right away, and the doc says, well, here you go, here's a sleep aid.
Yes.
And a lot of people like me can't take sleep aids because it just, you don't
side
feel right
effects.
the next day. I mean, you might get to sleep, but it's not quality sleep, and a lot of times you feel groggy and you've got a hangover from that. What are the side effects of using these type of appliances? Is there any downside to it?
Really, there's not. They're very comfortable. The patients are easy to adapt to them. Normally, within about the first week of using it, they're starting to feel the difference of being able to breathe at night. And so you feel refreshed versus feeling the grogginess that meds can often cause. And two, depending on the type of meds, they can make the problem worse if you have a sleep breathing disorder such as sleep apnea. So you have to be careful with, pain meds especially, that will relax the muscles even more than what they're naturally doing, and make the problem worse.
Yeah, I mean, so many people are medicated nowadays in one way or another. It's nice. It's kind of refreshing to have some sort of remedy to sleep other than a drug.
Absolutely. We look at the natural approach. We really want to try to get to the root cause of the problem and correct that if possible. That's what this type of appliance does. It actually grows and helps to correct the problem and overcome it. Or otherwise we can help to manage it. But the body, when given the right things, can often recover and repair itself. It's designed to do that in a lot of ways.
Yeah,
so that's what we look for.
And you just kind of help that process along by guiding it in the right direction.
Absolutely.
So
Non-invasive treatment is what we're aiming for. We really want to try to avoid surgeries and things that are going to be more invasive for you.
Yeah, because I sort of kind of recall a friend of mine having some soft palate surgery, and it was awful.
It is. It's a last resort in most cases. The effectiveness studies have shown are literally 40 to 50% effective, versus these types of appliances can be 70 to 80%, if not completely corrective for the patient. So we can have up to 100% success for someone and actually resolve their whole diagnosis, which overall their health is going to increase greatly after that.
So if someone's having a problem sleeping, maybe they're snoring, or they're tired during a day, or they're anxious, all they really need to do is give you a call, don't they?
Absolutely. You don't have to have a diagnosis when you call us. We can actually see you for a consult. We can determine what's going on and refer you to the right person to get diagnosed. Once you're diagnosed, I can help treat the problem if it's something within this realm. But otherwise, we get you in the right place to get you treated.
Yeah, so just give you a call, Dr. Tara Griffin here in Emerald Coast Dental Sleep Medicine. You'll give us a little how you doing, a quick little evaluation, and get the whole referral process going.
Absolutely.
To get the treatment you need to get a good night's sleep, and maybe cure your snoring and your sleep apnea. And that's unbelievable that you actually cure it.
We can for a lot of people, so that's the goal. We really try to aim to do that.
Dr. Tara Griffin, thanks so much for getting us smart on OSA, or obstructive sleep apnea. And if you're having a problem sleeping, come on down to Dental Sleep Medicine here out on Panama City Beach and see Dr. Tara Griffin. And we'll be right back.
Hi, this is David Lovett, and this is your Mad Hatter Minute. Today we're going to be talking about brake pads and brake systems on your car. the first question that I have to ask you is, how do you know when you need brakes? And typically, there's only two ways that you know you're going to need brakes. One, if you're driving and you apply your brakes and you get a vibration, most typically in the steering wheel. The steering wheel start vibrating, you know you got a problem. If you feel it in your seat, feel vibration back in your seat, you know you got a problem. Second way to know that you might have a brake problem is noise. You hear a squealing noise when you're pressing your brakes. What that is that the hardened metal on the backing of the brake pad is actually making contact to the rotor. And it's your sign, it's your signal to say, hey, there's something wrong, time to get it into a shop. Now, in a standard brake job, there are actually 4 different components that you typically look at. Many other components on a brake system, but on a standard brake job, you typically look at your brake hoses, your brake calipers, your brake pads, and your brake rotors. All right, the hoses provide the fluid to the caliper. The caliper closes the pads back onto the rotor. The pad has friction material that makes contact to rotor, and that's what makes your vehicle stop. Now, what I have here is your standard brake pad. Your brake pad has a friction material on the front, and it has backing material on the back. It also has this little tab right here that when you get low with the friction material, it's going to make a squealing noise. If you let this friction material get down into the squealer tab, it's going to squeal like a pig, and it's going to start damaging your rotor. Get your car fixed immediately. If it goes too deep into that rotor, you're buying new rotors. And soon, a $100 brake job turns into $200, $300 real fast. Don't play around with your brakes. This has been David Lovett, and this has been your Mad Hatter Minute.
Welcome back to the show. I'm here with Dr. Stephen Favaloro from Forest Park Animal Hospital, and he's going to give us our pet health tip of the week. Welcome to the show, Doc.
Good to see you today, sir.
My wife has been bothering me about this, and maybe you can help out. Our little dog, who is a Pug Shih Tzu mix, I have heard that breed is prone to having their tracheas collapse.
Well, collapse in trachea is actually a pretty common phenomenon that we see in veterinary medicine. Nope. It's generally a small breed issue, and the breeds I see it the most in, and that everyone sees it the most in, are going to be Yorkies, Poodles, Pomeranians. So those 3 we see them the most. But any small breed dog can possibly show the signs of it and develop it. And it's one of those things where you don't really notice it at first, but as they get older, it can really become pretty bad. And there are things that can make it worse. But basically, I guess we had to define what a collapse in trachea is. What does that mean? So, the trachea is basically a tube that connects from the mouth to the lungs, and it brings air in. You know?
And it's mostly cartilage, I guess.
Well, it's a C-shaped 3/4 semicircular, cartilaginous rings, and the open part where it's not connected is facing towards your backbone, but that's covered by a sheet of muscle called the tracheal membrane. Now, what happens is these semicircular rings are supposed to be rigid and stay open, so that way when you breathe in, air goes in fine, and breathe out, no problem. There's a vacuum effect on the walls when you breathe in and out like that. And the trachea is anatomically, it's going to be like outside the chest, so like from here to here, and then inside your chest from here to where your where your bronchi begin. So what happens is over time, these rings get weak, and so when you're breathing in, depending on where that collapse is, depends on when you're going to have your cough, whether it's going to be in or out. But before we get to that tracheal membrane is like a tight canopy, but as the rings get kind of weak, it can sag or it can balloon out. And so what happens is then if it's outside the windpipe, when you breathe in, it'll suck in, and then it'll irritate that tracheal membrane, and that'll elicit a cough. Or when the collapse is in the intrathoracic, is what they call it, it balloons out when they breathe in, but it sucks in when they breathe out.
And it's not supposed to do that. It's got to stay tight.
But what ends up happening is it elicits a cough. And so, and everyone's heard it before. Dogs run around, they kind of like and people are like, oh, my dog does that all the time. So the older they get, the more loose that membrane becomes, and the weaker the rings become. So it can be exacerbated mainly by activity. If you push on the throat, if it's more extrathoracic.
We went from a collar to a harness.
Right, because you're pushing on the throat, it makes them do it. But a lot of times people will notice it, and when they're sleeping, when the dog's sleeping, they'll get up and start coughing. And so the longer it goes, the worse it gets. And so generally, these things can be treated, by certain modalities. Another thing that can cause it, before we get any further, is like obesity. Obesity always makes it worse.
Right.
So as the pet gets older and they gain weight, then we start to hear this cough more. And so the more that they start to cough, then the worse it becomes. And what happens is, the first cough, is more irritating to the membrane, which then elicits another cough, and you get this vicious cycle, and you get this animal that's in distress. So finally they get over it, but it becomes easier for them to do it. So sometimes just being on a proper weight management protocol could help with that. Sometimes having some cough suppressants are helpful.
Really? Okay.
As long as there's no underlying like congestive heart failure. You don't want to suppress those dogs too much. And then because these dogs with the collapsing tracheas, they also are more prone to infections. So you need to, sometimes we'll have to treat them with antibiotics from time to time, because they'll get secondary lower airway disease. And there, but there's some dogs where it's just really bad and none of those medicines help, and they actually do have some prosthetics that you can use, but you have to go to a specialist for this, where they can put it in the windpipe wherever the collapse is.
Like a stent or something?
It's basically, it's exactly a stent. So, but the one stent that I know Auburn puts in pretty commonly, you can only use if it's extrathoracic. It doesn't work too well if it's in the chest. Okay. Now they're developing this new, and I don't know who's developing it, these like metal rings that you can put in, and they've had some pretty good success with those, but they've used such a small number of dogs that they don't know how it'll work with a larger population. But generally, if your dog is that bad and needs surgery, the surgeries can be successful, pretty successful, as long as it's done before 6 years of age. After 6 years, the success rate goes down significantly. But if your dog's
That's kind of ironic, because most dogs get that when they get older, don't
well,
they?
it gets bad enough to where it gets the owner's attention enough, but it is pretty ironic. So, if you're starting to hear your dog have that cough and it's getting worse, bring them to your vet, because chances are there's things that can be done. A lot of times it's weight management, a lot of times it's cough suppressants, but, we see it real commonly in small breed dogs.
Well, I guess the best advice is to keep your dog within proper weight limits, use a harness, and just keep an eye on them.
Yeah, absolutely.
Dr. Stephen Favaloro, Forest Park Animal Hospital, thanks for that sound advice.
Thank you, sir.
And we'll be right back. Welcome back to the show. I am here with our friend Marty Howell from Bay County Animal Services, and he's got his little friend Jewel here in the studio today. What a friendly, happy dog, Marty.
She just loves people, people to death. She's a lab retriever mix of some type. We're not sure. We actually, she was actually brought in as a stray, so we don't have any background on her. But we've had her since the first of the month. Just absolutely loves people. Loves to play. She's a good inside dog, outside dog. I say again, just loves driving in the truck.
Okay. So she has a lot of puppy behaviors too. She's kind of young, right?
She does. But again, she actually has her calm moments too, where when you settle down, she'll settle down with you. But I think when you want to play, she's ready to go for you.
Oh, she's all about it, man. And it took us all of a millisecond to become great friends.
Oh yeah, yep.
Yeah, this is an awesome dog. So you picked her up as a stray. She's still kind of young.
Right.
Been spayed.
Yep, she's been spayed. Got all her shots, so she's ready to go. So $25 gets you a dog that's ready to go, ready to be part of your household.
Yeah, and again, it only costs you $25
Right.
to adopt a dog at Bay County Animal Services.
Correct.
If we wanted to, if someone wanted to meet Jewel, and maybe if they have a dog already and they wanted to get acquainted with, could we just go out there and?
The only thing we ask is if you come out with another dog, and this is one of the things we do recommend, because Jewel herself actually, she's once she gets to know you, she gets protective of you, and if another dog comes around, she can get a little, she gets a little edgy. But I think if you brought another dog out, so they could be introduced, they become great friends,
Yeah. So bring your dog out, introduce her.
Right.
Or if you don't have a dog, she'd make a great family dog.
Awesome dog.
I mean, especially if you have kids or something. This dog
Kids, and like I said, just
dog is full of energy.
Loves everybody.
What a wonderful animal. And again, you know, $25 now. She gets a chip too, doesn't
Yeah,
she?
she's microchipped, so that's part of the $25 fee. So she's spayed, microchipped, has her shots. All you gotta do is get a bag of dog food, a couple bowls, and you're ready to go.
And the county does all that and will deliver to you at a very fine value.
Absolutely.
An animal that just give you years of enjoyment.
Yes.
So if you want to adopt Jewel,
Come on, Jewel.
I think Jewel wants to adopt me. You want to adopt me, Jewel? All right. What a pretty dog. If you want to adopt her, we could just go out there. We can call.
Yep,
Right?
it's 767-3333. So, or you can come on out, or you can look on our website at it's baycountyfl.gov. And actually, if you go on our website there, you can see all the dogs we actually have in our kennel that are up for adoption.
Oh, so we'll see Jewel on
Absolutely.
the website?
Absolutely.
And what's that website again?
It's baycountyfl.gov.
baycountyfl.gov. We can go out there. We can look at all the dogs that you have there that are available for adoption.
Absolutely.
And maybe learn more about Jewel.
Yep,
there as well.
take her for a walk and see how she does with your family.
Yeah, and if she's a little too frisky for you, you got other dogs.
We've got another.
Yeah, I'm sure we'll get to meet a few of those. Thank you so much for everything that you do out there, Marty, and thank you to Bay County Animal Services for making sure that these dogs don't wind up at the wayside. You know, I
Absolutely.
mean, you have strays, people abandon puppies. It's just horrible what people do to animals, and you know, she's too sweet a creature to.
And there's
have
lots
that
of good
kind
people
fate.
out there that can give them a great home.
Yeah, I think they can. Thanks for bringing Jewel in, Marty. And if you want to adopt her, go out to that website or just stop by Bay County Animal Services. And we'll see you next time.